Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and leadership. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. And now also our new network, the Health Podcast Network. For this episode, my 353rd episode, I have one of my favorite guests and longtime friends back on air, Matt Ethington. Welcome back to the show, my good friend.
Thank you. Thank you. Always a pleasure.
Same here. Great to have you. So first of all, before we dive in, how are you? Where are you calling in from? All that good stuff.
Well, I'm fine. Thanks for asking. Family's well, business is growing, and I'm blessed. I am calling from our new office. We moved in just towards the end of last year in Alpharetta, Georgia. I let my dad know I, finally got a top floor corner office. And he said, well, you had to build a company to do it. And I was like, yeah, I'm not sure if that's a good or a bad thing. But I'm calling from the top floor corner office.
I love it. Well, I know you've earned it. We've been friends for a very long time. I think now over, 11 years or so. I was there one of the very early days with Discharge IQ, but obviously ChronicCareIQ now. But no, and you guys had something very special, and you've absolutely proved that. And I've stayed close to the business for the last 11 years, and it's just so cool to see what you and Eric have built and what you're doing in the industry. And so that's why I think I brought this show to you with the idea, let's talk a little bit about the evolution of chronic care management strategies in general, a lot of evolution, a lot of opportunity. You and I are always talking about opportunity. But then also, we'll talk. I mean, you're great with stats. You're probably one of the best stats guy that I know. And so it's kind of cool. We'll talk a little bit about that, where there's some growth and where there's opportunity. And I think where we may not see some growth, that actually puts a spotlight on opportunity for care providers, for patients, and certainly for the government to continue to do their part in enabling these programs.
Yeah.
So, so kind of diving in there, but then also, I love to focus my show on key strategies and best practices. So, and you're, again, one of the best in the business. You've been doing this for so long. But again, to preface my audience, if you've not heard Matt before, he knows all the details. He's at every single level. Some people are at the high level. Some people are only in the minutia. Matt is at every single level, which is great because he's going to give you, he knows every best practice out there, certainly when it comes to chronic care management, CCM, RPM, you name it. You name the program, the model. Matt's got a best practice. And if he doesn't, he can get it really quickly from one of his customers. But he really has a lot of these things off the top of his head too, which is really, really cool. That's why I love to have him back. I love to have these very high impact shows. So that's a little preface for my audience. If they don't know you, Matt, as a starting point, how would you characterize the chronic care management industry today? Are you bullish, cautious, optimistic, cautiously optimistic? What are your thoughts there?
I am bullish.
Yeah.
I thought about it. So I'm bullish for a few different reasons, right? There's been a slow adoption rate of care management, and that's true. I think in the most recent data we have is about 20,000 unique doctors billed either RPM or CCM, according to the most recent Medicare data. And that's not a huge percentage of doctors, but the rate of adoption and increase as doctors are doing, it's accelerating by 40%. So here's why I'm so optimistic. The reimbursements that Medicare is supporting it with, and the number of codes that they're now paying doctors to provide care outside the office for doctors that treat patients that have chronic conditions, they continue to go up, right? The problem that care management was introduced and the reimbursements were made to incentivize still hasn't gone away. And in fact, it's bigger than ever. It's not only big in the US, it's a global problem, but essentially it's this. The amount of money that Americans spend today on chronic diseases and the cost to our economy is more expensive than the economies of the entire world except for the top three largest. So
Right.
Americans spend more
Combined.
on
Yeah.
chronic disease
Yeah.
than all economies except for the US, China, and Japan.
Yeah.
And that problem has to get fixed. And if it doesn't get fixed, because boomers are now aging at the rate of 10,000 a day for the next 15 years, more than 2/3 of them have 2 or more chronic diseases. And the problem's not been solved,
Right.
right? But it has to get solved because it just destroys the economy if it doesn't. So the reimbursements are great. They continue to move in the right direction. Awareness is starting to spread. Starting to spread. The awareness is accelerating at an accelerating rate, and the problem hasn't yet been solved. So more bullish than ever.
Yeah. So, and kind of when we're prepping for this show, I quickly realized we're probably going to do 2 segments on this because you just kind of highlighted why it's so important. It's so important for our economy. It's so important for our country. But most important, it's so important for patients. It's for
Yeah,
us as
absolutely.
individuals. Quality of life. That's what you and I always come back to. It's one of your biggest mantras, relieving pain. So so I'm very excited. Again, we'll probably do a 2-part show here. How do you see the chronic care management industry or the CCM industry evolving in the next couple of years? Not even 5 years or even 3 years, but over the next 12 to 24 months, what do you see some of the changes and evolutions?
So it's a great question. I'm glad you asked. I think the biggest evolution you'll see in care management are the systems that are out there to help doctors manage patients outside the office are going to evolve into patient management tools. So today you can do anything from hire a company to send your patient a blood pressure cuff and make sure that they get 16 readings in a month so you can check a box and get reimbursed, right? On the care management side, you could hire a third party to write you a care plan and try to keep patients on the phone for 20 minutes over a calendar month. But what the business is really about, it's really about patient management and helping to prevent pre-disease conditions to becoming full-blown disease conditions, to halt or slow disease progression to keep them from becoming adverse events like hospitalizations, and then to keep those events from uh, becoming more and more frequent. So it's really meant to impact patients with chronic diseases so that they can get the right information from their healthcare providers at the right time, and they can provide their healthcare providers the right information at the right time to spot disease progression and step in quickly to solve it.
Yeah,
So
I love it. I mean,
that
and that's
yeah, the answer to the question is these tools have to be about patient management to survive and to be meaningful in the market.
Yeah, and we'll dive. And I also want to dive into that even more deeply when we get to some of the best practices because that's the holy grail. These programs, you can kick them off as you and I have been talking for a long time about this. You can kick them off, you can start them, but they also got to have patient engagement because that's the holy grail. That's where it's truly becomes sustainable if your patients are engaged. Because then also, again, I don't want to preempt ourselves because we'll get into the best practices, but when your patients get excited about it, they start to see the benefits. Then it becomes just a cycle. Then the doctor's happy, the care provider, the nurses are happy, the administrators everybody's happy, the patients are happy. It's a cycle and
Yeah.
it's a self-sustaining
Yes.
program. And you guys have focused heavily on that. And that's always been near and dear to my heart because the very first company I ever helped start was Relay Health. And that was a physician-patient communication, patient enablement, patient empowerment. That was back in 1999, or technically 98, I think we incorporated, but 1999. So I'm all about patient empowerment, patient management, patient engagement. So I love it. In your opinion, where's the greatest opportunity for care providers in chronic care management today and in CCM today? Because obviously it's a big word. It can be intimidating at times. That's why I always want to do these shows with you because we want to push everybody into the pool. The pool's not deep. It's very shallow. It's very easy to get started. But where's the greatest opportunity for care providers to think about, hey, how can I do this? If I'm not part of that, 4% or 6%, quote unquote, that have really truly started a meaningful program, what's the opportunity there and why?
It's financial stability for ambulatory practices.
That's
I
excellent.
mean, that's the biggest opportunity, and um, it was uncommon before care management for Medicare to increase reimbursements, to add new reimbursements, right? Usually they were bundling and shaving things down, and but the care management infrastructure of reimbursements is significant. And so I'll just give you an example. The first reimbursement of CCM, which is chronic care management, they're time-based, and it pays $64 when you can establish that your clinical staff, right, not just your providers, but your clinical staff, your MAs, your LPNs, when they have spent 20 minutes of non-face-to-face, or they've spent 20 minutes of time on non-face-to-face care activities. So if you think about where are these staff when they're not in the room with a patient? Well, they're in the EHR or on the phone about a patient.
Right.
So these, and there was a study out of, it's not Johns Hopkins, out of Rutgers, that shows roughly 10% of a practice is responsible for 70% of the external care management activities. So this, a lot of this is for work that's already being done, and it pays $64 for the first 20 minutes. But it also pays multiple increments of 20 minutes. So if you can't monetize 20 minutes perfectly into an hour, but if you could, that's $192 an hour. And if you could extrapolate that into an annual salary, it's $384,000 a year. It is a huge profit opportunity for a lot of work that practices are already doing. And it's Medicare saying, hey, we see you, we want to help. Here's some basic rules and regulations, and here's how you submit your claims. And now there's not just one category, which is called CCM, there's 8 categories. There's pain management, there's specialty care, there's behavioral health. There's even a new device code called RTM, which is remote therapeutic monitoring. It is definitely the way that Medicare is trying to resolve the ramifications of accelerating chronic diseases, right? If the doctor can get involved with the patient when they're at home, when they're outside the office, then they are significantly getting a head start on $15,000, $20,000, $25,000, $40,000 hospitalizations, which is where all the money is spent.
Right. Yeah, and this is where my passion goes back to. People say, "Why do you spend so much time on Capitol Hill?" Because I was never paid to go to Capitol Hill. It actually cost me a fortune to try to go there on a monthly basis. But because creating these programs, trying to create a healthier population, or at least stemming the rate of healthcare cost growth, not only higher quality of life for patients, but we can't continue on layering on 10% annual increases, or 20%, or 18%, or whatever the percentage. It's high every single year. Our healthcare costs go up. Again, we're trying 6%, 8%, 10%, whatever it is. Every year it's a little bit different. It's not sustainable, and it hurts our future.
It's completely unsustainable.
You got it. So that's why
an Undersecretary of Health and Human Services told me in his office, it doesn't just break Medicare; it breaks the U.S. currency.
There you go. That's exactly right. Great point. And now, I mean, not to get ahead of ourselves, but there's over 30 codes, correct? I mean, that's significant now. There's so much opportunity for so many people in different specialties. So
there's over 30 monthly recurring codes.
Right. There you go.
And then there's the setup, the implementation, those types of codes. That's awesome. I think we will see pent up demand once the industry understands what the business is in its entirety, and then how they can use systems to automate a lot of this work so it doesn't disrupt the care they already provide, but enhances the care that they already provide. Right now in offices, it's a little bit disruptive, and it hasn't been made clear a path like, hey, here's how you do this.
Right. And I guess following along the lines, you just covered a little bit, but maybe to dive in deeper again, I want to give care providers and administrators and these care planners and these even care managers, the reason to do this, or do it at a larger scale out to, they might do 50 patients or 100 patients or 200 patients, go to 200, 300, 400, 500 patients. So what wisdom, and you obviously have a lot, been doing this heavily for over 10 years now, what wisdom can you share with where you see CMS evolving the chronic care management programs, but also any new codes, reimbursement additions, reimbursement shifts? What do you see from your perspective and what you're reading and what you're experiencing?
We see from Medicare, the APCM codes that came out in 2025, they're essentially chronic care management codes, but they don't require time measurement to capture reimbursement. So the reimbursements are less, but they are table stakes, if you will, for Medicare saying, hey, go ahead and get involved. And if you didn't capture a minimum 20 minutes on this patient, that's okay. Here's a reimbursement to help you sustain this initiative and keep it going. And then if you do capture the 20 minutes, then you default to the higher reimbursement. And I think that's a big change, right?
Right.
For Medicare to move in that direction. But they know that these are the value-based care programs that work, because when they look at the models with CCM, patients that are enrolled in CCM, they show a dramatically lower monthly cost to the system. So they're trying to incentivize doctors and encourage people to get enrolled in these programs.
Yeah, love that. Yeah, I mean, and it also shows that CMS does listen. They're obviously looking at the data, but they also do listen. I mean, they're highly collaborative. Every administration that I've ever worked with has been highly collaborative. They only care about doing the right thing. And it's all, so it's a reason why you got to take the time, you got to educate, you got to either, do your testimony, share your testimonies, written, whatever experience you have your doctors, your care providers, even some of your patients share their experiences with Capitol Hill. I just finished a radio show yesterday talking about that and why I did it. So that's why it's all fresh in my mind. I highly encourage people to do that when they can. You and I were talking offline a couple weeks ago, and you said, "Hey, Justin, I really do agree with what you said around chronic care management being a natural glide path to value-based care." What have you seen, or what do you see now that makes you believe that? What brought you to that?
Yeah. So what I try to do in some of these more complex models, and first I want to validate what you said about Medicare, because they used to be viewed, oh, they're slow and this is bad and everything's horrible. They are without a doubt a leading payer in innovation,
Yeah, there you go.
clearly. But there's so much of it, it being able to distill it like, all right, how does it apply to me at the 1 doctor, 5 doctor, 20 doctor level, not the big health system, but what can we do to participate? So just wanted to
Yeah, thank you. Awesome.
encourage people, like, take a look at these care management programs. They are significant reimbursement. It saves a lot of money. It saves a lot of heartache for patients. So that said, I forgot the question.
Oh no, you said with the
Oh,
value-based care.
value-based care.
Why is it
Absolutely.
natural glide path? Yeah.
Right. So when I look at all these complexity things, like, well, what's value-based care essentially? How do I break that down at the ambulatory level? How do I simplify it? I'm like, well, it's better outcomes for lower cost,
Yeah.
right? So if you say it, and if you believe that, outcomes is patient suffering, cost equals utilization. So if you're trying to prevent cost, you have to prevent utilization. If you're trying to prevent utilization, you have to prevent human suffering. So when I see where all of this goes, and it being the glide path into value-based care, well, if a heart failure patient has it well managed, they're not bouncing in and out of the hospital,
Right.
right? If a type 2 diabetic has the ability to interface with their doctor has the ability to interface with them when they need a little extra guidance, then they're able to stabilize their blood sugars a little better, right? And what we do, unfortunately, in healthcare is, because patients simply don't know what to do, they're not getting, it's like your car, they're not getting the oil change in the car, so eventually the engine blows up, and the engine blows up in the hospital, and that's where that's where we get all these crazy expenditures. So if we track that back to, how do we strengthen physician-patient relationships to avoid patient suffering, that's
Right.
how we lower cost.
Love it.
So because utilization starts with the patients, and patients saying, hey, when I left the hospital in 2001 with type 1 diabetes, right? So I was 30 years old. That's the kind you have to give yourself shots. I left with 2 prescriptions, a pep talk, and the
Yeah.
instructions to find a doctor, right?
Right.
Where do you think that people like me end up, right? I've poked over 20,000 holes in myself, and I was young, I was ambitious, I was energetic, and I figured out how to get it done. And as healthcare has evolved, we really haven't created a patient management tools. We
Right.
created a portal where they could log in and pay, but we didn't create an outreach mechanism checking on patients. And that's how I see it being a glide path to
Absolutely.
value-based care. That's how I see the systems evolving over the next few years, and that will create the consumer demand that supplements the reimbursements, which are generous. And because managing patients that are generally well is a lot easier and less burdensome on a practice than working with patients just out of the hospital to keep them stabilized, it's a it's a win-win-win.
Right. So no, and I think my audience knows this, but value-based care, risk-based contracts, value-based care is the future of healthcare. So this,
It
again,
has to be.
following a natural glide path is really important. And for all of you that may have joined us a little late, my guest today is Matt Ethington, good friend of mine, good friend of the show, but is also co-founder and CEO of Chronic Care IQ, and also a chronic care management expert. So again, we'll be probably doing a couple of different shows here because we have so much content to cover. And again, this is such a foundation for where healthcare is going, but also where healthcare is going to be in the next 2 to 3, 4 years. So it's a very a timely topic. We've got a couple minutes left, but let's now dabble a couple best practices, or at least one out there from a high level. In your perspective, your expert opinion, what defines a truly successful care management program in today's healthcare landscape?
Yeah, well, thanks for asking. I have a bit of gravity in this area because
Absolutely.
since we started the business, we've set up over 750 practices, right? And in the early days, it was really tough. The reimbursement was $42. You had to evangelize on every street corner to get a doctor to even like consider it. They're like, "What? They pay for what? How do they do it, etc." Um, but now we've cracked the code on sustainable care management.
Absolutely.
So, and that's what's important. And there's 4 areas that I can define sustainability in a highly successful care management practice. Number one, they have to be clinically sustainable. The doctors and nurses have to get something out of the program for them to do it. So for them to do it, they have to be getting curated information from patients so that they can keep patients well, and they'll come back to the system, right? So it starts with patient engagement. That's a foundation to clinical involvement, which is foundation into clinical sustainability. There has to be financially sustainable. Sustainable. Look, I love ministries, but ministries are difficult to sustain.
Right.
So when Medicare shares those rewards and those reimbursements that, hey, we can either pay for them in the hospital, inpatient, we can either pay for strokes or we can pay for blood pressure management. Um, Medicare's super serious about let's get these patients into programs, and the reimbursements are great. As long as you can perform the job at scale, the reimbursements are remarkable.
Right.
And then that comes into operational sustainable. If I'm creating extra burdens on everyone in the practice every day, it's not operationally sustainable. So the tasks that people you have to minimize the extra work that's required, and you have to make it fit into the day. So operationally sustainable, we feel like that's making chronic and fragile patients easier to care for.
Mm-hmm.
And the last one is the one that everybody misses. They have to be administratively sustainable. It is amazing that any healthcare administrators in America uh, aren't constantly in therapy and have any hair left at all.
Right. Yeah.
The burden that we have placed on the business of ambulatory medicine, it's just it's just shocking, right? Somebody should write a documentary about it. So if you can create to implement something and to make it sustainable, it can't become a nightmare on the people that are keeping the doors open. And so 4 levels, right? Clinically, financially, operationally, and administratively sustainable. Those are the keys to highly functioning in terms of outcomes, in terms of financial outcomes, everything. Those are the keys to success in care management.
Awesome, Matt. Well, we're basically at time. So that's a perfect lead up to our second part that we will do probably next week. And continue on down this path because it's critically important. I know that you not only lead a company, but then also you do a lot of evangelizing in industry on the side just to help practices, whether they're your customer or not. You help them with best practices in engaging a care management program. You've got a great heart for that. I've seen you do that for a long time. So let's pick up next week on diving in more into those key strategies and best practices to thrive around chronic care management. And we'll go from there. Is that fair to you?
Yeah, thank you.
Awesome. Well, thank you so much, Matt, for joining me today. It's always great to have you on air, my friend. And I truly appreciate you taking the time out of your schedule to join us. And again, thank you so much to all of my listeners. You guys are fantastic. I'm grateful. You also voted us 2024 Podcast of the Year. Could not be more fortunate and blessed for that. And please tune in weekdays as my show broadcasts at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me LinkedIn at Justin T. Barnes or track me on Twitter at HIT Advisor. And you use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all of my shows are posted at YouTube, Spotify, Apple iTunes, Amazon Music, Megaphone, SoundCloud, iHeartRadio, and TuneIn. And also added a lot of new content at justinbarnes.com. I know we're on a lot of platforms. Very, very fortunate and blessed. But thanks again, Matt, and thanks to everyone. Have a great rest of your day.